Hi, I'm Dr. Paul Fisher, and today I want to talk about cervicogenic headaches, their causes, what that means, and what you can do to help. Now, a cervicogenic headache is a headache that comes from the cervical part of your spine, which is your neck. Using our model here, a normal neck, you have a nice curve, and you'll have nerves that go from your neck up and around to the base of your head. Everything works well. Now, what happens in a cervicogenic headache is that due to a abnormal structure in the neck, whether it's you've lost that curve or because of a trauma, say a car crash, that curve has been reversed, is this will put stress and pressure on the nerves coming out of your neck here that go around to your head, and you'll get headaches. Many times patients talk about how they'll feel like a spike coming right at their eye, or they'll have a very diffuse pain going all on the side of their head. And what you need to do is really to work to restore that normal curve in your neck to take pressure off those nerves. Now, cervicogenic headaches are probably one of the most common headaches that we see. And while we do really well in this office with almost all headaches, cervicogenic headaches, we typically have the absolute best results with. And there's more and more research coming out showing that an improvement in the curve in your neck not only has good short-term, which is 4 to 6 months results for headaches, but also 1 year, 2-year follow-ups that those results are maintained, which is almost unheard of in any kind of care. In the office, our care here really depends a lot on what each patient has going on. And also too, is we talked about what the curve looks like from the side. We're also concerned is if your head is on top of your shoulder straight, if you're shifted one way or the other, that's going to create another set of issues that we also need to work on. So what are some things that you at home can do to improve the curve in your neck? Well, one of them, and it's the easiest and is unfortunately the most difficult for us to take on, is to not spend so much time hunched over laptops, cell phones being the big ones like this. If you are going to have them up like that, or just really keeping your head over your shoulders so that you're not going further like that. The other one is, this is not only an exercise to stop doing, but an exercise you can start doing. One of the worst exercises that you can do is called a chin tuck. If you're not familiar, they go like this, and you're pulling back. You'll have people talk about how this is like you're giving yourself a chicken neck or chin retractions. What we found is that what that does is it actually flattens out the curve in your neck and can create even more problems. Now, this gets concerning is because people will do that exercise and it will look from the outside like their posture is improving. Posture is absolutely important. It's a window into what's going on with your spine. But if you have a straight neck, even if your posture looks good, that's going to cause issues. Now, a better exercise that will help the curve in your neck is you'll sit or stand, shut your chin out, look up slightly, and then pull back. Again, you're going to shut your chin out, look up slightly, and then pull back. This actually works to improve the normal curve in your neck and strengthen it. Do this for about 10 to 15 reps. Hold for a second or two with each rep, and you can do this once or twice a day. Really simple and easy. You don't need any equipment for it either. If you've been suffering with cervicogenic headaches for a while, the best thing to do too beyond that would be to come into our office and see if we can help. This is a condition that typically responds very, very well to chiropractic care, and long-term, the improvements hold, which is always wonderful. Again, I'm Dr. Paul Fisher with Gold Coast Chiropractic. Thanks, and have a nice day.